Hey everyone, Michael Harris here. Today we're talking about something that could literally save your brain.
And Hiroshi Saito. Michael, how many medications are you taking right now?
2. Blood pressure and a statin. But the average American over 60 takes 7 medications daily.
And at least 3 of those are probably damaging their brain. Not might be, probably are.
We're talking about common pills, sleeping aids, allergy medicines, acid reflux treatments.
Things your doctor hands out like candy. Things you buy over the counter without thinking twice.
Today we're covering 5 categories of medications that increase dementia risk by as much as 50%.
We'll tell you exactly which ones, why they're dangerous after 60, and what to do if you're taking them.
I had a patient, Robert, 72 years old, retired engineer, brilliant guy. One day his wife calls panicking. He can't find his way home from the grocery store.
How long had this been developing?
18 months of gradual decline. Memory lapses, confusion, personality changes. We ran every test. 3 neurologists said Alzheimer's.
What was it really?
Benadryl. He'd been taking 25 milligrams every night for 15 years for allergies. Seemed harmless.
And many of you watching take the exact same thing.
We stopped it. Within 6 weeks, his wife called, crying happy tears. "He's back," she said. Not 100%, but 70 to 80% of himself returned.
The damage from 15 years, some of it was permanent.
His short-term memory never fully recovered. But his personality, his ability to reason, that came back. If we'd caught it sooner.
This is why we're doing this episode. Robert's story isn't rare.
It's tragically common. Let's start with category 1, anticholinergics.
Most people have no idea what an anticholinergic is.
Your brain uses a neurotransmitter called acetylcholine. It's essential for memory, learning, attention. Anticholinergics block that messenger.
They literally prevent your brain from communicating with itself properly.
After 60, your brain already produces less acetylcholine naturally. Then you add a medication that blocks what little you have left.
It's like driving with the emergency brake on.
Here's what terrifies me. People don't realize which medications are anticholinergic. Diphenhydramine, that's Benadryl, but also Tylenol PM, Advil PM, NyQuil, most nighttime cold medicines.
Doxylamine, that's Unisom. Dramamine for motion sickness. Oxybutynin for overactive bladder.
And many people take multiple anticholinergics at once without realizing it. I had a patient taking Benadryl for allergies, oxybutynin for bladder, and amitriptyline for nerve pain.
3 anticholinergics. What happened?
She couldn't remember conversations from an hour ago, couldn't follow TV shows, started getting lost driving. Her family thought early Alzheimer's.
How fast did she improve after stopping?
3 weeks. She was 90% back to normal. 3 weeks. She'd been declining for 2 years.
There's a University of Washington study from 2015. They followed 3,400 adults over 65 for 7 years.
The ACT study. People who took anticholinergics regularly had a 54% increased risk of dementia.
54%. And the risk went up with duration of use.
Even scarier, the increased risk persisted after people stopped, meaning some damage might be permanent.
This is why prevention is everything.
Go through your medications, all of them, including over-the-counter. Google each one plus the word anticholinergic.
Make a list. Take it to your doctor and ask, are there alternatives?
For allergies, try nasal steroid sprays like Flonase, not anticholinergic. For sleep, address the root cause. Don't mask it with Benadryl.
Overactive bladder. Pelvic floor physical therapy works better long-term than oxybutynin.
Category 2. benzodiazepines and sleeping pills, Xanax, Valium, Ativan, Klonopin, Ambien, Lunesta.
These are some of the most commonly prescribed medications to seniors. Doctors write them for anxiety, insomnia, muscle spasms.
Patients love them initially because they work. Take a Xanax, anxiety melts away. Take an Ambien, you fall asleep fast.
But the cost is devastating.
They enhance GABA, which calms brain activity. Short term, that can help in a crisis. But long term, you're sedating your brain every day.
After 60, your brain is already slowing down naturally. You add a medication that slows everything more, you're accelerating cognitive decline.
There's a French study, British Medical Journal 2014. They followed over 1,000 seniors for 15 years.
Those who used benzodiazepines had a 60% increased risk of dementia. The risk was highest for those who used them more than 3 months.
I don't even know how to put this into words. I just feel so heavy, like there's a weight pressing down on me that I can't shake off. Everything feels dull, and no matter what I do, I can't seem to lift my mood. It's like a deep ache inside, and I don't know when it will go away. I just want to be alone for a while. Maybe then I can make sense of all this.
In Japan, we have strict guidelines. Benzodiazepines for acute situations only, maximum 2 to 4 weeks.
The other problem is dependence. Your brain adapts. If you try to stop, you go through withdrawal, anxiety, insomnia, tremors, sometimes seizures.
Patients say, "See, I need this." But they're not a mess because they have anxiety. They're a mess because their brain is dependent.
I had a patient, Margaret, 68, on Xanax for 12 years. Her daughter said mom's not herself anymore. Flat affect, couldn't remember conversations, repeated herself constantly.
What did you do?
Very slow taper. 10% reduction every 2 weeks. Took 18 months to get her completely off.
And by the end?
More herself than her daughter had seen in a decade. Her personality came back. Memory improved dramatically. She started painting again.
This is why I get frustrated with American prescribing. We're solving short-term problems by creating long-term disasters.
If you're on benzos or sleeping pills, don't stop cold turkey. That's dangerous. But do talk to your doctor about a tapering plan.
And if your doctor won't help you taper, find a new doctor.
Category 3. Proton pump inhibitors. Medications for acid reflux. Omeprazole, Nexium, Protonix.
Michael, you were taking one of these until recently.
Yeah, omeprazole, 20 milligrams every morning for 3 years. I had reflux. The medication made it disappear.
What made you stop?
I read the research on dementia risk and realized I was being a hypocrite. First 2 weeks were hell, rebound reflux. But I changed my diet, stopped eating after 7 p.m., elevated my bed.
And now?
Reflux is 90% gone without medication. Turns out I didn't need the PPI, just better habits.
This is the story for most people on PPIs. Overprescribed for conditions that could be managed with lifestyle.
PPIs shut down stomach acid production. But stomach acid is essential for absorbing vitamin B12, magnesium, calcium, iron.
B12 deficiency causes cognitive decline that looks exactly like dementia. Memory loss, confusion, difficulty concentrating.
I've seen patients diagnosed with Alzheimer's who actually had severe B12 deficiency from long-term PPI use.
And is reversible if caught early?
Often, yes. Stop the PPI, give B12 injections. Within months, cognition improves dramatically. But if you don't catch it, permanent nerve damage.
A 2016 study in JAMA Neurology followed 73,000 seniors over 5 years.
German study. Regular PPI users had a 44% increased risk of dementia.
In Japan, PPIs are prescribed conservatively, 4 to 8 weeks, not indefinite use.
In America, people take them for decades. Many can't remember why they started. For most conditions, you don't need a PPI.
H2 blockers like famotidine are safer and often just as effective, or antacids for occasional heartburn.
If you've been on a PPI for more than a few months, get your B12 level checked. I want my patients over 60 above 400 picograms per milliliter.
Category 4, statins. This one's controversial.
I take one myself, so this is personal. Statins lower cholesterol. For people who've had heart attacks or very high cardiovascular risk, they save lives.
But for healthy seniors, taking them for prevention.
That's where it gets murky. The FDA added a warning about memory loss and confusion to statin labels in 2012 because of so many reports.
Why do statins affect the brain?
Cholesterol is essential for brain function. Your brain is 25% cholesterol. It's used to build cell membranes, make myelin, produce neurotransmitters.
And statins reduce cholesterol production throughout the body, including in the brain.
I had a patient, Barbara, 71, sharp as a tack. Her doctor started Lipitor 40 milligrams for high cholesterol. No history of heart disease.
Primary prevention.
Within 3 months, her husband brought her in. She can't remember our grandkids' names. She got lost driving to the grocery store.
And you suspected the statin?
Only thing that changed, we stopped it. 6 weeks later, back to normal. Her cholesterol went back up, but she got her brain back.
A 2019 study in BMJ looked at statin use in people over 75 with no history of cardiovascular disease.
No mortality benefit. Statins didn't help them live longer. So we're giving medication that might affect the brain with no proven longevity benefit.
To be clear, if you've had a heart attack or stroke, the benefit is clear. Take the statin.
But if you're a healthy 70-year-old with slightly elevated cholesterol, that's a conversation you need to have with your doctor.
Category 5, polypharmacy. Taking 5 or more medications at once.
The average American senior over 65 takes 7 medications. In Japan, it's closer to 4.
Almost no one has studied what happens when you combine 7 medications in an aging body.
Clinical trials test one medication at a time, usually in younger, healthier people. When your 75-year-old is on 7 medications, you're conducting an uncontrolled experiment.
And their brain pays the price. Medication interactions are unpredictable.
There's also the prescribing cascade. You prescribe medication A, it causes side effect B. So you prescribe medication C to treat side effect B.
Before you know it, the patient is on 6 medications, half treating side effects of the other half.
I see this constantly. Patient on a PPI for heartburn. PPI causes low magnesium. Now they're on magnesium supplements. Magnesium causes diarrhea. Now they're on Imodium.
Meanwhile, the original heartburn could have been fixed with lifestyle changes.
Every medication affects your brain. After 60, your liver and kidneys don't clear medications as efficiently, so they accumulate.
You're walking around in a mild fog all the time. Patients say, I don't feel as sharp. Doctors say, well, you're getting older.
No one questions the medications. I had a patient on 12 medications. Her daughter said, we think it's Alzheimer's.
What did you do?
Spent 3 months carefully deprescribing, stopping medications one at a time, finding alternatives. Got her down to 5. Cut her list in half.
And her cognition?
Night and day. She went from unable to manage her own pills to playing bridge again with friends, like watching someone wake up from a long sleep.
At least once a year, sit down with your doctor or pharmacist. Go through every single medication.
Ask, do I still need this? Could we try a lower dose? Are there non-medication alternatives?
Don't assume that just because a doctor prescribed it years ago, it's necessary forever.
Let's recap. Number 1, anticholinergics, Benadryl, Dramamine, oxybutynin. They block acetylcholine, essential for memory. After 60, they're toxic.
Number 2, benzodiazepines and sleep aids. Xanax, Valium, Ambien. Long-term use increases dementia risk by 60%.
Number 3, proton pump inhibitors, omeprazole, Nexium. They cause B12 deficiency, leading to cognitive decline, often unnecessary.
Number 4, statins, Lipitor, Zocor. Necessary for some, overprescribed for others. Can cause memory problems, especially at high doses.
Number 5, polypharmacy, taking 5 or more medications. Each additional medication increases cognitive risk exponentially.
So what do? First, don't panic. Don't stop medications cold turkey without medical supervision.
Make a complete list of everything you take. Prescriptions, over-the-counter, supplements. Write down the name, dose, and why you're taking it.
Schedule a medication review with your doctor or pharmacist. Ask about each one. Do I still need this? Are there safer alternatives?
Start with anticholinergics. If you're taking Benadryl for allergies, switch to Flonase. If for sleep, address the root cause.
For benzodiazepines, ask about a slow taper. For PPIs, try lifestyle changes or switch to an H2 blocker.
Get your nutrient levels checked, especially B12 if you're on a PPI. Also, vitamin D, magnesium, folate.
Optimize your lifestyle. Sleep 7 to 8 hours. Exercise regularly. Eat a brain-healthy diet.
Be an advocate for yourself. Don't assume your doctor knows everything. If something doesn't feel right, speak up.
Don't accept it's just aging as an answer. Often it's not aging, it's medication. And medication is fixable.
Your brain is precious. It's who you are. Protect it fiercely.
Even if that means having difficult conversations with your doctor.
Even if it means changing habits you've had for years. Prevention is everything.
Start today. Make that medication list. Schedule that appointment. Take control of your brain health.
We want to hear from you. Are you taking any of these medications? Drop a comment below.
If this episode helped you, share it with someone over 60 taking multiple medications. This could save their mind.
Next time, we're talking about coffee. Something Hiroshi's been after me about.
Your 4 cups before noon? That's not healthy.
We'll settle it with science. Until then, take care of yourselves.
Stay sharp.